Hi, Dr. Raj here, and today I want to talk about the evaluation of a non-GAP metabolic acidosis. So first, if you were to get an arterial blood gas, remember the pH will be low, the CO2 will be low, but the bicarb will also be low. And when you calculate the anion gap, which is the serum sodium minus the serum chloride minus the serum bicarb, it's going to be normal. So what is the next step in figuring out the etiology of this non-GAP metabolic acidosis? You got it. You must calculate the urine anion gap, which is the formula of the urine sodium plus the urine potassium minus the urine chloride. Now, urine chloride is going to be the most important conceptually. Why? Is because when your body has a metabolic acidosis, you want to dump out hydrogen ion in the urine. It binds in the kidney to NH plus 3, which is ammonia, which turns to ammonium, NH plus 4, and that ammonium needs to bind with chloride when it goes to the urine. So we don't normally check a urine ammonium level, so we use urine chloride as a surrogate to tell me, hey, the kidneys are working. So how does that translate to clinical medicine for your board exams? If someone has a non-anion gap metabolic acidosis and I calculate the urine anion gap, if the kidneys are doing its job, it's going to be dumping out lots of ammonium, meaning that chloride is going to be high. So a urine sodium plus a urine potassium minus a huge chloride will give you a negative urine anion gap, meaning the kidneys are great. The problem's where? In the GI tract. Probably going to be diarrhea. If you calculate the urine anion gap and there's just a little chloride, it means that the kidneys are not doing its job. They're not dumping out ammonium. Therefore, you have a urine sodium plus a urine potassium minus a very little urine chloride. The answer is a positive urine anion gap. The problem is where? In the kidneys itself. Think about a renal tubular acidosis. Bottom line point is, if the urine anion gap is negative, the problem's in the gut. If it's going to be positive, think about renals, think about RTAs. That's my pearls for the board exam.